In this video, I'm going to discuss fish diseases, general diagnosis, control strategies in disease-free fisheries, bacterial diseases and nutritional diseases of fish. I am Mohammed Abdul Karim. Fish suffer from many bacteria and parasite diseases causing organisms which respond to topical application of drug. Bathing is an efficient means of treating fish. It is important to test the water before treatment of fish commences. In other words, physicochemical parameters should be known through water quality analysis. This can simply be done using water quality test kits. General diagnosis in fish. Daily close observation of the behavior of fish is very necessary. The most obvious signs include a sluggish feeding response, darkening of the fish body, respiratory difficulties, abnormal swimming, plastine, ulceration and excessive mucus. Plastines, you will notice or observe fish rubbing its body on the wall and any other solid surfaces. Control strategies in disease-free fisheries. Some of the ways of controlling diseases in fishery include general sanitary conditions, supply of balanced feed, supply of disease-free water into the fish ponds. Recycled water should be exposed to ultraviolet light as to kill potent microorganisms that can cause diseases to fish. Bacteria are normally present in ponds and only become a problem when fish become stressed. Bacteria can infect a single fish and multiply rapidly to cause substantial high mortality of fish in days or weeks. They are often identified by their damage to fish tissues. So it is advisable you start treating bacterial diseases immediately after you stock your fish ponds. Bronchiolitis is a highly contagious bacterial disease of fish. It has the potential to cause high levels of mortality in farm fish population. The etiological agent of bronchiolitis is the bacterium Rhamnosus salmonicida. It is a gram-negative rod-shaped bacteria. The clinical signs associated with bronchiolitis may be seen with almost any septicemia infection diseases of fish, that is, disease in the blood. You will notice a boil lesion or bloody boils on the skin. The disease causes ulcer in the muscles tissues. It then spreads through the skin and eventually becomes a site for fungus infection. There will be reduced intake of feed. The disease is detected by the putrid smell arising from freshly dead or dying fish when it is cut open. There will be high mortality The disease causes death with no further symptoms. Treatment: fish pond should be drained and treated with slake lime. Disinfect evil tools used in the ponds, especially nets, buckets, and feeding rings, etc. Many types of antibiotic can be used. This is caused by filamentous bacteria, Fexibacteria. The clinical signs are very obvious. There will be discolor patches on the body of the fish and gills. White spot on the mouth, edges of scales and fins are observed. There will be lots of scales and often death may occur. Lesions begin on the scale of fish as small circular erosions that have a gray-blue center and red margin while on the scale. The fish lesions begin at the outer margin of the fins and spread inward toward the body. High mortality normally occur in rearing catfish. Treatment: give the fish a feed which has retramycin in it. You can also treat the pond with 1 part per million of copper sulfate. It is also advisable to change water and add salt. Dropsy is caused by bacteria Pseudomonas punctata. It is not a specific disease, rather a symptom of a deteriorated hair condition. Symptom in fish: you will notice an accumulation of body fluid, that is water in the body cavity of the fish. There will also be swelling and projected scales. Give the fish broad spectrum of antibiotics. Penicillin, tetracycline, and nalgesic work effectively in treating this dropsy. Bacterial enteritis. The causative agent is Pseudomonas of intestine. If the fish is dissected, it will reveal an accumulation of liquid in the abdominal cavity, and there will be also red violet color of body surface. You can treat this fish with antibiotic medicated feed. 1 capsule is enough to treat dozens of fish. A good antibiotic is chloramphenicol or use tetracycline. Nutritional diseases. Nutritional diseases are mostly caused by deficiency of vitamins and minerals. Vitamin deficiency, especially folic acid, you will notice skin lesions and poor growth of your fish. Folic acids are all B complex. Vitamin C, there will be blood problem and poor growth, while vitamin A is also blood problems, poor growth, poor appetite, eyes disease, edema, that is pot belly. Mineral deficiency, calcium deficiency, you will notice or observe skeletal deformities. There will be impairment of nervous transmissions. As for phosphorus, there will be skeletal deformities and poor growth. While potassium deficiency, you will observe reduced osmotic regulation of the body fluid. Sodium, it will affect the acid-base balance. Generally, these treatments are very effective in fish ponds, concrete ponds, tanks, or tarpaulin. It will be much more easier in the acting pond if you maintained good water quality. You allow water to get into the pond and the same amount going out through the outlet for at least 1 hour. And after you change the water partially or completely, you can add common salt. But it's not easy and cheaper to use salt. You will end up using bags and bags of salt, and it will become very expensive. So give them medicated feed and change water every day, partially or completely change of water. It will not cost you much. All you need to do is just to buy 2 liters of oil to do this partial or complete change of water. Thank you. If you like this, subscribe